repeatedly we are getting questions on the vitamins, particularly the water soluble vitamins from the B complex. So here we got the question: in vitamin B12 deficiency, which of the following enzymes will be involved? So let us quickly take a look at the highlights for vitamin B12 and then let's come back to this question. Okay, vitamin B12 is required only for two enzymes: methylmalonyl coenzyme A mutase, also known as the isomerase, and the methionine synthase. These are the two enzymes which require the vitamin B12. Methylmalonyl coenzyme A can come from multiple sources, for example, in the catabolism of valine, for example, by carboxylation of propionyl coenzyme A. Okay, propionyl coenzyme A itself can come from various sources, from isoleucine, cholesterol, or the odd chain fatty acid. And directly from propionate, we can get the propionyl coenzyme A, which will then get converted into the methylmalonyl coenzyme A. Vitamin B12 is found only in food of animal origin. So the so-called vegans, which is pure vegetarian, who do not even consume the milk, have high risk of the B12 deficiency. In India, most of the vegetarians are consuming the milk and the curd. So the curd and the milk will have significant amount of B12, particularly the curd. Therefore, B12 deficiency is rare in Indian vegetarians. All right. To be very correct, the Indian vegetarians will be called the lacto-vegetarians. They are not vegans. They are lacto-vegetarian because we are consuming the products coming from milk. Milk is coming from the animal source. Okay. So they found in only of animal origin food. And vitamin B12 requires two very important components for absorption, which you have to remember. Cobalamin, which is secreted by the oral mucosa, or you can say the salivary glands. Meaning, if there is any damage in the secretion in the salivary glands in the mouth, the cobalamin will not come out. Okay. So if there is any dehydrating disease where the secretion from the mouth is getting affected, then intrinsic factor is secreted from the gastric mucosa. So again, if the gastric mucosa is getting affected, the intrinsic factor will not be released, and therefore the absorption of B12 will not occur. For example, if you have the atrophic gastritis, in that case, the gastric epithelium mucosa is getting denuded, it is not getting synthesized properly, and intrinsic factor will not be released. These two are required to transport and help in the absorption of the vitamin B12. Please note, the absorption occurs only in the ileum. So if ileum is removed because of any reason, maybe there is trauma, maybe there is infection, because of which the ileum has been removed surgically, in that case again the B12 will not get absorbed. B12 contains cobalt. Okay. Second important point about vitamin B12 is the deficiency causes methylmalonic aciduria, the conversion of methylmalonyl coenzyme A to the succinyl coenzyme A. The methylmalonyl coenzyme A is getting converted into the succinyl coenzyme A, which requires the vitamin B12. So when there is B12 deficiency, the methylmalonyl coenzyme will accumulate, resulting in methylmalonic aciduria. All right. The very common cause of B12 deficiency is the defect in absorption, which is occurring only in the ileum. Typically, dietary deficiency is rare unless you are a very strict vegan. The dietary deficiency is very, very rare. B12 deficiency, as you know, results in pernicious anemia, which has two components. First is the megaloblastic anemia due to B9 deficiency, or you can say the folate trap. B12 is required for the recycling of B9. So when the B12 deficiency is there, the functional B9 deficiency also occurs. We call it the folate trap, which is responsible for the megaloblastic anemia. In addition, the methylation of arginine residue on the myelin basic protein, which is responsible for the myelination of the sheath, which is defective, and we will have the irreversible degeneration of the spinal cord. This is the pernicious part of the anemia. This is the irreversible degeneration of the spinal cord. So again, in some cases, when you find the megaloblastic anemia and you supplement with B9 and you have not noticed that okay, B12 deficiency was there, whatever B12 is there will be diverted towards the recycling of the now excess of the B9, and the degeneration of spinal cord may be aggravated, meaning the neurological signs and symptoms may be aggravated if you give B9 supplementation in B12 deficiency. And a very characteristic finding in B12 deficiency is the knuckle pigmentation. Knuckle pigmentation is seen in the B12 deficiency. So if you find the anemia, along with that you find knuckle pigmentation, immediately you can think about the vitamin B12 deficiency. Now let us go back to the question. In B12 deficiency, which of the following enzymes will be involved? Methionine synthase, yes. Methylmalonyl coenzyme mutase or the isomerase, yes. Homocysteine synthase, no. Folate reductase, no. So answer should be 1 and 2. Answer should be 1 and